Can aesthetic treatments be done for people who are pregnant or breastfeeding? That's a very common question that patients ask us, and they demand it as well, because obviously during pregnancy, there are certain changes or the effect of the Botox or the filler that they had before wears off. And so obviously I want to get a new application, a new dose. There are even patients who argue that there are no scientific articles that have literally proven there is a problem at the moment or during pregnancy applying Botox. So some patients do their research and demand it from you. What I explain to the patients here is that obviously they won't find articles, because articles are basically made in, there are several types of articles, but one very common thing is that someone is given a placebo and someone is given the correct treatment or the active substance to measure changes. And the other is, to the entire population that is studied, the treatment is given to see who they are, those who have the most results, who are the ones with less, who has more satisfaction or less satisfaction. That's how aesthetic treatments are studied a lot, based on satisfaction. Well, obviously, you won't find any study from any university where they took 100 pregnant women and applied botulinum toxin to see whether it causes a side effect in the baby. I mean, this would be against medical ethics. So obviously, you won't find studies that prohibit it because they don't do it. It wouldn't be ethical to conduct these studies. So during pregnancy, practically all aesthetic treatments would definitely be prohibited. I mean, Botox shouldn't be applied. It shouldn't be applied. Hyaluronic acid, you shouldn't apply peels. There are peels that contain high levels of salicylic acid, and this can affect the condition, penetrate, obviously, but the skin, but they can reach the whole issue of the circulatory system, and then this circulation will reach the baby. So let's not expose patients who are pregnant to peels. The topic of mesotherapy as well, the biostimulants. I mean, practically a person who is pregnant is meant to focus solely on skincare, home care, personal well-being, overall wellness, and overall lifestyle. And obviously under the supervision, ideally, of a dermatologist. And of course, the topic of deep cleanses. If the skin gets very oily, then cleaning it once a month with deep cleansing facials is really good. And here I go. Starting with the topic of breastfeeding. Every day there is less breastfeeding, or everyday breastfeeding is much shorter. But well, if the patient is breastfeeding, then yes, we'll make a distinction. For example, botulinum toxin is still not recommended in international standards. It's not recommended, but for example, hyaluronic acids are already considered safe. There's still controversy with the toxin. I mean, there are recommendations that yes, there are recommendations that no. I'm talking about breastfeeding, not pregnancy. And also the topic of breastfeeding with hyaluronic acids. There are already international consensus statements that say it is safe. Also, the topic of gentle peels. I mean, the peels that are mild, no, the medium ones, not the deep ones. And of course, everything related to laser treatments, all the intense pulse light stuff, everything that involves fractional CO2, everything that is, everything that involves lasers in general can be done at that moment. In conclusion, if you're pregnant, don't do anything at all except for a deep cleansing facial or any other facial that doesn't involve a peel. Of course, microdermabrasion and this type of equipment that doesn't use chemicals that can penetrate and reach your bloodstream. And on the other hand, if you're breastfeeding, then the only thing I would recommend is not to get Botox. And in general, all the other treatments could be done. Okay, there are international consensus statements. A while ago, I'm talking about around 10 years ago, the international consensus statements, they told you nothing. I mean, no threads, no fillers. And this has been changing in recent years. Basically, it's obviously based on the need to look good after a pregnancy. Thank you very much. Have a great day.